Awesome, awesome. Welcome everyone to our December episode of The Doctors Are In. And this is going to be our last Doctors Are In for the year of 2022 because we're getting ready to transition into 2023. In any case, we thank you for being here with us. We are here to serve you. And the purpose of our virtual health clinic is to allow you to be part of our global healing village. And in our global healing village, we are here to serve you and address any of the concerns, questions, thoughts that you may have pertaining to any aspect of health and wellness. Each month, we have various practitioners who are with us that would contribute to the conversation. And the most important person is you, because you help us to bring forth the questions that are out there in the community. And I guarantee you that whatever question you have, hundreds, if not thousands or tens of thousands of people have the very same question. And subsequently, this gives them a resource to be able to get those questions answered in an environment that is conducive to open debate, open questions, and most importantly, is committed to pursuit of the truth. So without further ado, I want to introduce the wonderful Dr. Silla, and we have Dot, we have myself, Dr. Michelle, and each of us brings a different aspect of expertise to the conversation. So we had a question. I think it was either Ms. Karen or Dr. Silla who had a question for Dot.
Yes, I have a question for Dot. If shoulders and backs are your thing, I'm wondering if you've dealt with complex regional pain syndrome, CRPS. Are you familiar with that?
Is that what? I don't know a lot of the acronyms. When people feel like there's pain and the source of the pain is no longer there.
Right, where the brain is on a feedback loop and creating the pain, like after an injury or after surgery, and there's unexplained excessive pain in a limb. Are you familiar with that, or have you worked with that at all?
Some, not a lot. That's not my specialty, but I've seen it.
Yeah, I'm just wondering.
What has been your experience in that area?
Looking for new answers. I tend to ask a lot of questions and just find out what's going on with the person. So sometimes one can identify by asking questions. Money is one of the things that lives in the back. And so I just ask questions, if somebody died recently, or just to see why might the body still be holding on to this, to see if there's some that kind of source. And I look at all the physical stuff, but I'm assuming when you ask that all the physical stuff has been ruled out.
Right. Yeah. So there's always an emotional component to it, but I just wondered if you knew of any modalities or methods to kind of redirect the brain, reprogram the brain.
Yeah, sometimes what I do a lot is movement, very specific targeted movement, combination, stretching, strengthening, targeted. So a lot of times if you move that limb or whatever in a way that is more typical, it can learn to make a new pathway.
Right. Well, thank you.
I was wondering, could you talk a little bit more about what you said in terms of thoughts or anxieties pertaining to money, and that it resides in the back, like which area of the back, and what are some things that can be done, as Dr. Silla was saying, to shift the energy or break up, decongest the energy? Yeah.
So again, I'm assuming we've ruled out there's no decompression, there's no inflammation, there's no muscle imbalances. It's usually the low back, across the low back, and it'll be even, whereas a lot of low back pain is more on the right or more on the left. If it's money, it'll be even. And that'll come out, I'll sometimes say, money lives in the low back. And there are a lot of responses from from clients to that. Oh, really? Well, that, and all of a sudden you get a whole new story. And sometimes just telling them that money lives in the low back, they can like, oh, this started when, and they can start to put it together and help their healing. I like EMDR for getting the brain rewired. Eye movement desensitization response, I guess you all know. For therapy, it's like one of the fastest, I think. So if there's no other, well, what am I supposed to do? Well, if you know when it started or what it's related to, then EMDR is a good modality for rerouting that thought process.
So could you talk a little bit more about what EMDR is for those of us in our village that are not familiar with that terminology, and what it's for, what it does, that kind of stuff? And maybe even experiment with one of us, who would like to do a, kind of session.
Yeah, no, that's done by a licensed psychotherapist.
Oh, okay.
EMDR, eye movement desensitization response. So there's a whole protocol where you ask a lot of questions and they call it the target. What is it you're trying to rewire? But it's basically a tracker. I use a little ball with a light. I mean, I don't do it as a practitioner. I do it as a participant. And it's a tracker where the eyes are moving and you revisit whatever your trauma is that you're trying to rewire. And there's something about how the brain works as it follows, your eyes follow slower than that you can feel the trauma leave. You rate it at the beginning, like, oh, that's an 8 for me, and then you rate it afterwards. And usually it's dropped a number of points. So Dr. Silla looked like you were in agreement around EMDR or nodding your head. Do you want to add that?
Well, it's a great modality. I think it just accesses both halves of the brain so that both parts of the brain are engaged. Then, more balance can happen. So, but like you said, you revisit the trauma, you're moving your eyes back and forth, or some therapists use a little clicker where you're holding something in each hand and it's giving a pulse in each hand, activating each side of the brain. And then, the stress will come down. But the therapist first has to know the trauma history, understand the trauma history, know what they're going after, know what the target is. But yeah, I've seen it. It's a good modality. And then just vagus nerve stuff, different eye movements, different breath work for the vagus nerve to tone that and calm the nervous system.
Good point.
Now, Dr. Silla, when we route what Dot was saying with regards to concerns about money and how that resides in the back, are there homeopathic remedies that help someone to release angst about money?
Yeah, that's a good point. Yeah, definitely. It's part of the big picture. So we can look at never well since a financial issue, never well since leaving a job, never well since the death of someone. So there are particular remedies that may suit that sort of picture, basically. In terms of just acute things, I've seen lots of back issues, sciatica, or just lower back issues, helped with rust tox, with Cali carb. But again, these have to be sussed out in terms of the symptom picture. But if you're just looking acutely at different things, I had a young woman in her 30s with severe sciatica, and we gave her rust tox, we gave her hypericum for the nerves. So yeah, it's so individualized. There could be 10 cases and they each get 10 different remedies.
I know when I work with clients pertaining to that, one of the first things I encourage them to do is to really watch the breath and to notice where the breath is starting and where it seems to be hung up. And a lot of times when people have that back pain, I notice that they're holding the breath. They don't even realize that they're holding the breath. And then that translates to tension along the entire spinal area. And it also creates a situation where you're not allowing the body to fully access the vagus nerve. So the vagus nerve is the nerve that will help you to shift out of that angst that, oh my God, lions and tigers, bears, oh my God, I have no money, the world is coming into an end, and shift into that, oh, it's okay, it's okay, it's okay. And so one of the things that we talk about is actually loosening the energy that may be congealed or stagnating within that lower lumbar curve, and doing that with breath work, but also with movement. So putting your hand on your hips and pumping the hips forward, rocking the hips forward as you're breathing to open up that area in that lumbar curve, and as you're doing that, to start to also incorporate the affirmation that money flows.
Mm-hmm.
And in actuality, not even necessarily labeling it as money so much as labeling it as currency.
Right.
Because it's a current, the electrical currents in the body, the water currents in the earth. All of those are various forms of energy. Money is simply a form of energy. And so if we start to relate that money to all of the different forms of currency or currents in our world, currency or currents in our body, whether it be the breath flow, the flow of our thoughts, the flow of our emotions, and to allow the movement and the breath work to open things up and to allow things to flow. And it's amazing how much our thoughts will prevent the flow. If our thoughts are stagnant, meaning that we tend to perseverate, we tend to loop in this constant thought of, oh my God, I have money problems. Oh my God, I have money problems. Oh my God, I have money problems. And to shift it and say, energy is flowing. Energy is flowing. And wherever my attention goes, energy flows. So if my attention now goes to my diaphragm and my attention goes to expansion, that is where the energy is going to flow. So
yeah, that's great advice. I had a client once who used to sometimes pay me more than I asked for. And she'd say, I need to open up the flow. I need to get the flow going because I'm feeling stagnant. Because the more you put out, the more comes back. And it's interesting. It's energy.
Yeah, I can definitely relate to that because, even as a practitioner and as a businesswoman, I have to shift from that perspective of sparsity. And I have to create the abundance in my awareness and in my thought patterns in order to allow it to manifest in my actual reality. And so the same thing that I'm sharing with my clients, I have to do that. If I'm here like, oh my God, I can't buy anything, I have no money, then that's the kind of people that I'm going to attract to me. And that's not going to help my business. So, I intentionally go out and say, you know what, I'm going to buy some programs. I'm going to invest in myself. Because if I don't invest in myself, how can I expect other people to invest in themselves and therefore, procure any of my services? So I definitely agree with you, Dr. Silla. Very, very true. Yeah. Okay, so any questions from those of you who are here before I go to the questions that I have in our little vault?
I have a question or two or three.
Yay, go for it. Yay. Love them. Yay, go for it.
Okay, so my mom was diagnosed with melanoma back around, well, this all started in like September. and then they started say, oh, this is urgent and it's deep and it's wide and we need to get it out as soon as possible and all this stuff. But then when we went to an oncologist, they already did a biopsy, and the oncologist heard something in her heart. So then she had to go to a cardiologist, and mistakes were made in a few different offices. So we're still not done with all the stuff to get cleared for the surgery. So like, how urgent is this? And she still has to go get a stress test on Tuesday and to see if she can get anesthesia to get that out. And then also, I've read things about like putting turmeric paste on it to maybe shrink it or something, so maybe they don't have as much to dig out or whatever. But what do you mix the turmeric with?
I would mix it with castor oil.
Oh, good. That's what she did. That's what she had.
Because castor oil is known as the palma de Christi, the palm of Christ, and it has very therapeutic and healing properties. It's also known to be able to dissolve and break up, things like warts and, skin lesions and things of that nature, calluses and things of that nature. So I would definitely consider mixing it with that. And also perhaps another alternative is black seed oil, so, and then your good old vitamin E. Can't go wrong with your vitamin E and vitamin A. Those are the ones that are known to help with skin, and not only in terms of rejuvenation, but also for their significant antioxidant properties. So I would consider those three options.
Like mix them together?
Well, either you can mix them together, or you can, try one for a couple of days and compare it to trying something else for a couple of days. Or I just kind of go with the spirit and, see what comes forth. I'm not really a person for recipes. So I'm just like, I like this.
But I'll tell you what's really interesting about that. So I had given her castor oil for something else, and she got a thing on her face and a thing on her arm at the same time, and she was putting the castor oil on it. I didn't tell her to do it, and the one on her face fell off. We had to wait about a month to get an appointment with a dermatologist. The one on her face fell off. And I think the one on her arm was probably going to fall off if we had given it a little more time, but they cut it off when we went for the appointment.
Well, there you go.
Yeah, but I wonder how urgent, how urgent is this surgery?
What is your mother's belief system? Does your mother feel anxious and want to have surgery? Is she reluctant? Is she more natural? What is she?
All her, she's been really natural. She's not on any medication except thyroid, and she's 86. Wow. And she takes some supplements, but she's like the healthiest, oldest one in her building. But she has really fair skin. And I think she's gotten too many sunburns, maybe. But she is anxious about the surgery. She knows she doesn't want the lymph nodes out because she wouldn't do radiation or chemo even if it had spread. So there's no point in doing that. But she is nervous.
I think our mindset, our belief system is a huge part of how urgent anything is and how we heal. The body is designed to move towards perfection. That's kind of our prime directive. And the theory of German new medicine, I don't know if anyone's familiar with that, but it says one of the biological laws is that we bring up disease in an effort to improve. So our brain creates a tumor or something, and by the time you actually see it or feel it, you're in the healing stage. So, and it's the prognosis or the treatment or the shock of the diagnosis that starts to send you down the rabbit hole. So there's a lot to be said for just confidence in real immunity and the human spirit.
And in alignment with what Dr. Stella was saying, what came to me immediately when you shared what was going on is, does she believe that God is in control? Because if she is in that particular persuasion, the way I would interpret it is, God sometimes puts roadblocks into things that I'm trying to rush, that I'm trying to push. And if I've done everything on my part to allow a certain process to move to the next level and stuff keeps coming up, then something in my mind says, it's time to let go of this thing that makes me think that it's urgent. Because I truly believe, but this is my personal belief, that if it were truly, truly imperative that I get this done, then the doors would open. If I've done everything on my part, so I'm sure that, she's done whatever they had as their checklist for her to do. And these things are coming up that have nothing to do with her. They're not under her control. So for me, that gives me pause to think, okay, relax. And what is the saying? Know that I am. Take a breath and know that I am. And sometimes the very things that we are pushing for are things that are actually not conducive to where we need to be or where we need to go at that point in time. So that's my 2 cents.
Oh yeah, it makes perfect sense. she just goes, whatever.
Yeah. Okay, Sarah, and not a kind of, oh, whatever, but it's like, you know what? God is in control. God has got this. I've done my part. So I've got to be able to lean back, let go, and let God, and know that he knows what I need, or she knows, or however you want to personify it, The only thing I would add to what you said, Karen, is, do you know what her vitamin D level is?
Yeah, it was like 69.
Okay, so she's in a good space then. Okay, so that's one of the things I always check. I always check for the vitamin D, the vitamin A, the vitamin E, because those are the ones that deal a lot with the skin, and also the levels of collagen, so things like bone broth, and vitamin C to help with the healing process of the dermis. So.
Also, if she does have surgery, I would do arnica beforehand, like 30 C of arnica for a couple of doses before the surgery. And then after the surgery, continue either a 30 C or a 200 C of arnica 3 times a day for a couple of days. And there'll be less scarring, there'll be faster healing, and it'll help with any pain also.
Okay, I'm writing this down. You said 30
C or 200 C. Ideally, if you could get 200 C after the surgery and do 2 to 3 doses a day for 2 days after the surgery. And you can go to homeopathyworks.com. That's Washington Homeopathics. And they're in West Virginia. They have good quality remedies. You can order the Arnica Montana 200 C.
Okay.
And then she should take 1 dose before surgery and then 2 to 3 doses a day after surgery for 2 days.
So is it preferable to use the 200 C versus the 30 C, or do you use the 30 C before and the 200 after?
You can, if she sounds healthy, she's on no meds, she has no real chronic illnesses, I'd say do a 200, just one dose, like before the surgery, 1 to 2 doses, and then after the surgery, 200 is fine.
Okay. Thank you.
And, in alignment with that also, Karen, if to work on the emotional aspect of it, she may want to consider some Bach flower remedies, the rescue remedy that helps to allow her to release this sense of angst,
Yeah, she's a perfectionist. She's apologized to me lots of times and sorry, she was quality control all her career. So everything, I mean, like the forms are ridiculous what you have to fill out for every doctor, and you have to fill them out online and stuff. And I'm just like, if you don't do it, they'll give you forms, they'll hand them to you when you get there, whatever, But she's like, gotta do it right.
Wow.
Hey, Dr. Allie, how are you doing? How's Mexico?
Fine, thank you. Mexico is cold now.
Really? I don't put those two together. I don't think of cold and Mexico in the same sentence.
Pretty cold. It was 3 degrees centigrade this morning, Celsius this morning, just 3. So pretty cold.
Where
is that normal during this time, or is it kind of unusual?
It's usual in winter.
Wow.
What part of Mexico?
I grew up in Belize.
In San Miguel de Allende.
Oh, is that on the west side?
Part of Mexico?
Northwest?
It's like at Centro, in Mexico, central part.
up in the mountains? Isn't
the mountains. That will explain it.
Feet, yeah.
Oh, that explains it. Because I was like, I grew up in Central America in Belize, which is right below Mexico, and I don't remember it being cold. But the mountains, that would explain it. Oh yeah. Well, hopefully the warmth of our hearts will warm you up, because we just love to see you here with us tonight. Absolutely wonderful.
Thank you.
Karen, you had any other questions? Because you said you had a couple of them.
It was like about you guys answered them all. One was about the tumor paste and I think so. Yeah, the other one was like, how urgent was this?
Oh, okay. Awesome. Any other questions from those of you who are here with us? You got Kate. She's got a question.
I always have a question. I could have wondered what habits you have for your own personal health, especially the doctors. What habits do you have, or routines that you have, that keep your own strength up? Because you're giving a lot of energy to us, right? And so what's your process of renewal of your own energy?
That's an awesome question. Who wants to jump into that first?
I would love to speak to that, because I've been doing this process for 5 years now called Miracle Morning. Has anybody heard of that? Anybody familiar with it? It's a 1-hour process that includes writing, visualizing, affirmations, meditating, working out, and reading. And each one of those, the guy who put it together said, each one of those is a rejuvenating modality. And so he put this morning together to include all of them. And so some mornings I do more of some of them than others. I'm a big believer in exercise because that's my modality, but exercise is wonderful for flushing crap and getting the brain to stay awake and rejuvenate. And one could say the same thing about meditation and breathing and visualizing and affirmation. So that's mine.
Awesome.
Yeah, and there's an online community of Miracle Morning. I mean, I would recommend Miracle Morning to anybody.
Okay. Nice. Dr. Allie?
Well, what I do is, as soon as I get up, I have a glass of warm water with half a lemon, turmeric, and cinnamon. That's like my daily mix. That's the first thing I drink. And then I meditate for about half an hour or 40 minutes. And then I exercise. I try to exercise every day. I like to do HIIT, that's high intensity interval training. Sometimes I can do a short one if I'm in a rush. So I only do like a 10-minute HIIT, or if I have time, I can do a 20-minute HIIT. And on the days that I don't feel very too much energy, I do yoga for 10 minutes or 15 minutes or 20 minutes, depending on the time I have. And at the end of the day, I also like to do breath work. So I go to see the sunset. That's like the greatest part of my day. And while I do some breath work. So that's my energy job.
Okay,
Awesome.
May I just ask a question? Your proportions of lemon, turmeric, and cinnamon, like for, you have a cup of water?
Gosh. It's,
I
don't really have proportions, but it's on about 250 milliliters of water. I don't know. It might be like 8 ounces or no, about 8 ounces.
Yes.
With half a lemon.
Okay.
But here in Mexico, lemon is the green one, not the yellow one.
Right.
And about, let's say, about a teaspoon of turmeric and half a teaspoon of cinnamon.
Okay.
But I don't dose it. I just pour it.
I know. You're like Michelle. Like my grandmother, she would say, "Oh, you do it till it looks right."
Exactly.
My kids always complain about that, because sometimes I get like a really good recipe and they're like, "Mom, now we don't know how to do it all over again." I'm like, "Oh well, I guess we just gotta try it again." So that is hilarious. Oh boy. Dr. Silla?
Yeah, I do yoga. I do breath work. I do juicing, a lot of juicing. I like to juice celery with a little bit of green apple. Sometimes I juice carrots with lemon in there and ginger, or beets or beet greens. But I do that just about every day. I do the elliptical. I like the non-weight bearing exercise, and I have a vibration plate for lymph drainage. So I stand on this vibration plate for 15 minutes. Let's see, what else do I do? So I do the yoga, the breath work, juicing, meditation every day. I have a infrared lamp that I get under in the winter sometimes for the light and the heat, and meditate under that. Some sound therapy. I have some different things that I use for sound, and mostly plant-based diet, predominantly a plant-based diet. So those are my things. And I'm an avid reader, so I'm always reading and, searching, learning, collecting information.
What is your quest right now?
German New Medicine.
Oh.
Yeah, German New Medicine has really engaged me. There's 5 biological laws. Actually, if you go to my website, which is realimmunity.org, O-R-G, and click on up in the top, there'll be podcasts. And I have 2 podcasts that are listed there. One of them, I'm talking about the 5 biological laws in German New Medicine. And another one, I'm interviewing a German New Medicine practitioner. So those are both on those podcasts. And I've been studying that with a couple of people in Canada and Europe weekly, like 3 hours of classes a week, and doing my own therapy with one of them also. So yeah, it's fascinating. It's basically, it's a principle that the psyche creates all disease. So let's say you have a mother and a child walking across the street. The child's hit by a car. The mother's shocked, upset, worried. The child's in the hospital. The brain starts to send signals to the breast to nourish the child. This is a primitive response that we all possess. So then the child gets out of the hospital, the child's fine, and now the woman has a tumor. She finds a tumor, and that's the healing stage. So that's not a problem. That's the body's healing stage, because the brain sent all these signals to form more tissue. And in our modern world, where we run to doctors at the first sign of anything, we go through screenings and testings, and and then the woman gets the shock of a diagnosis, and that shock makes the brain do some other things. So, we can trace all pathology back to what is the brain doing to produce this, and it's doing it in an effort to survive. So
Right.
it's a healing act. So I'm just fascinated by the whole principle. The man who kind of developed it, Dr. Hammer from Germany, he had testicular cancer after his son was killed. And he was a physician who worked in a cancer hospital and found that all of those patients had some trauma that preceded their diagnosis. So he started doing testing, and he's no longer alive, but his legacy is this body of knowledge called German New Medicine, or Germanic healing.
That is awesome. Wow.
It's
And
big.
it really emphasizes, as you were saying, that we misinterpret the body's healing response as disease.
Right.
And we target it, creating the real problem.
Right.
So,
Right. Exactly.
whether it be fevers or inflammation, or the development of tumors, as you said, or cysts, all of these various things are the body's attempts to rebalance, to find some way of going back to a healthy position.
Right.
But we sit there and we attack it.
Mhm.
And by us attacking it, we create the problem. We create the actual imbalance.
Exactly. And, one of the most fascinating things that I've learned in German New Medicine is that there is no such thing as metastasis. It does not exist. It's a hypothesis in conventional medicine, but a breast cell cannot become a bone cell, or a liver cell cannot become a blood cell. Histologically, it's not possible. And if cancer could travel in the blood or in the lymph and spread, then why don't blood banks screen for cancer when you donate blood? They don't screen for cancer. So one of the practitioners in Europe said that she bet someone a doctor who worked in a cancer clinic, show me the studies that show metastasis, the action of metastasis, and proves it. And she couldn't come up with it. It's a hypothesis that's become dogma. And when you tell somebody this is going to spread and kill you, that's another biological shock, that prognosis. So anyway,
I completely agree.
Yeah, and it turns medicine upside down. It's mind blowing. So I'm in the process currently of trying to integrate this with my homeopathic background. And I had a client today who had a flare up of gouty arthritis in her knee. And I asked her when it happened, and she said, I was going to visit my daughter. And I said, tell me about your relationship with your daughter. And she proceeds to tell me that her daughter cuts her off at the knees, never listens to her. She has to walk on eggs. She feels, disrespected. And then she goes on to say, that's how my father treated me. And I mean, there was the whole case right there based on German New Medicine, that the brain creates this as a response to the psyche. Yeah, it's really fascinating.
And that is what really came to light for me, I would say about 10 years ago, when I realized that it was not simply about the physical. And what I've told people since then is the physical stuff is actually easy, to deal with the physical aspect of our health and well-being, which is just, to me, the tip of the iceberg in terms of symptomology. So whatever the physical manifestation is, it's very indicative of the fact that there's a significant blob underneath the water. And the
Right.
imagery of being under the water is very deliberate because it is within our spiritual, mental aspect, emotional aspect that created the tip of the iceberg. And so even when I work with my clients, I tell them that is why it's going to take us a year, because there's so much stuff that you don't realize is creating that physical manifestation, whether it be your high blood glucose or your heart palpitations or your high blood pressure. Yeah, everybody wants a little pill. And so they come to me looking for the supplement pill or the herbal pill, or for you, Dr. Silla, the homeopathic pill. But now you're starting to realize, well, that's just another pill. But the reality is we've got to go deep. And in going deep, that is where the true healing occurs. And so to answer your question, Kate, for me, what I've started to recognize is the need to do consistent check-ins. And so my routine for the day varies on what I get as my check-in. So the first thing I do is I ask my body, what do you need today? When it comes to my food, what kind of food do you need today? What kind of exercise do you need today? What kind of meditation do you need today? And I look to see where the energy is stagnant in my body. And I look to see what the thoughts are that are going through my mind. What is it that I'm feeling in that moment? And that will give me an idea as to what I need to apply in that day as the quote unquote antidote. So if I sense that, you know what, I feel like my bowels are kind of congested, then that's going to determine what I eat or don't eat for that day. Or if I feel like, you know what, I feel like my energy is really low. I think I need a boost of energy. That's going to determine what exercise I do or what kind of breathing pattern I do. So the biggest thing for me is to allow that space for my body, my heart, my mind, my soul to talk to me, and for me to actually listen and respond accordingly. And to be okay with not really knowing sometimes. And to say, I'm still unclear. And to just keep asking the question, what do you want? What do you want? So right now I'm going through my seasonal cleanse. I always do a cleanse in December as we enter into the solstice and enter into the new year. And what's been coming up for me is there's something that's not settled. There's something that's like off, for me spiritually. And that is what I need to delve into. So giving myself that process of checking in is what I think is most key to me nourishing myself, because it'll vary. But the only way that I know what to nourish myself with or how to nourish myself accordingly, it's to do that check-in, because what I needed yesterday is not necessarily what I need today, is not necessarily what I'm going to need tomorrow. So to have that flexibility with all areas of my life. So whatever it's worth.
Love it. Thanks so much, everybody, for doing that. I wanted to just say one little thing about check-in. Today I was having a session with my sister and my niece. And my niece she actually puts her fingers on her pulse. She takes her pulse. So it's a physical action that says, okay, now I'm checking in. So just a little something that I'm gonna try to do it, because it's another, how do I say it? It's a physical thing that you do with your body that says, okay, now I'm checking in, right? Just a little something.
And your body's always talking to you, you know, and
Yes.
your body is a way for you to get the messages that are coming from your heart, that are coming from your soul, that are coming from your mind, because it's just easier for us to access this. Because of
Yes.
how we've been trained in Western society, it's easier for us to access this. If we were trained in another type of society, we would easily be able to tap in and get a heart reading, for instance, or a soul reading or a mind reading. But that's not how we've been indoctrinated. So this is phenomenal, because when you go to ancient Chinese medicine, the pulse will tell you so much. Dr. Huante, what your thoughts?
Oh,
Look like you were going to say something.
Yeah, I wanted to talk, well, not about the pulse, but yes, as you have been saying, we have been trained to see something, to have a proof, to act upon what is happening to us. So maybe another idea could be using kinesiology. It's a way to ask your body and to have a response or an answer with your body of what you need. And as Michelle said, that she gets to herself and asks herself, what kind of food do I need? What kind of meditation can I do today? You can ask yourself and have a response via kinesiology. There are different methods, or even using a pendulum. There are a lot of people that use a pendulum and they put it like on their hand or on their heart chakra, or even on an image of your chakras. And that way you can ask, do I need to take a veggie juice today? Can I do juicing today? Can I do whatever? No, and there always an answer. There's always an answer, but we don't pay attention to that because, as Michelle just said, we're not taught to believe in our whole system. So it's good to always ask ourselves, what do we need? And there are different methods, but one way is to go to our hearts. But if we need a proof of something, you can use a pendulum or kinesiology.
Yeah,
and I know one of the old-fashioned ways. One of the old-fashioned ways, old-fashioned, is to have your book of scripture, whatever it is that you feel is a book of scripture, and to just open it to whatever page, and whatever your eyes go to first, that is spirit talking to you and giving you guidance for that moment in time. Kate?
I was just going to say, when I'm talking about taking your pulse, it's not really taking your pulse. It's not, it is a thing that you're telling yourself. It's like when Michelle was talking about the knees, or for me, it's, I get blockage because I haven't said my truth. I haven't spoken it. And so then I hold my breath because I don't feel like I can speak, right? So it's just taking your pulse is just another physical thing. And it's not, I'm not really taking my pulse. I'm not timing it with my watch or anything. It's just another way to remember and to tell my body, okay, now I'm checking in, right? Now I'm checking to see. And like you said, there's so many different ways, and it's so fun to find out what other people do to check in, you know? It's so fun to find out the systems. That's why I wanted to ask you what you were doing.
Karen, what do you do? What's your
me?
thing? Yeah.
I do sauna every evening.
Oh God, I would love to.
I do yoga sometimes 3 times, like today was 3 times. I walk outside. And I eat healthy plant-based diet, whole food. Yeah, I think that's it.
What about you, Kate? What do you do?
Well, I've been working on my neural pathways. And so it's like you have irrigation ditch and the water is diverted off. So I want to dig a new ditch and then block off that water, but the water will already have a place to flow. And I do that through the motions with my body that are connected, motions connected with emotions. So for the emotional intelligence, I have 7 things that I do with my body that are connected. Like, for instance, this is hope. You slide the H off, you plant it in the body. So there's those 7 aspects of emotional intelligence that I have made up a specific motion that I do. And sometimes when just for example, that hope one, sometimes when I'm starting to be low on hope, and my body will just automatically start doing this, and then I'll notice it. I'm planting that hope in my body. So it's really, really fun. I enjoy it. The joy comes out. The joy that's already within me comes out because I get to do all these cool things. And I get to discover what other people are doing. I'm really excited about that whole process.
Awesome. Well, what I would like for us to close the year out with is, what is your summary? What word do you feel you could use to summarize 2022? I know that's going to be a challenge. A word, or, a 3-word sentence. So, but not like a whole paragraph. Okay. So this is going to be challenging. I know, especially for myself. I can be too wordy. So who wants to go first?
I'll go first.
Yay.
I'd say 2022 was challenging, but full of opportunities. So that's it.
All right.
I'll go next. For me, 2022 was a change and new beginnings.
I'll go. For me, 2022 was a year of abundance and adventure.
Yay.
I'll go next.
Oh, you're breaking up there. We didn't hear you.
2020.
Oh gosh, she's breaking up. Oh Lordy. Can you type it into the chat, Thomasine, and then I'll read it out? Okay. Who do we have left?
Probably me.
Yay.
It's been a year of letting go of some things that don't serve me and getting closer with more like-minded people.
For me, it's the discovery of the I am. And my latest I am statement is, I am a creative, curious child.
And Thomasine has here, 2022 was a year of learning to live. Ah, like that. And is that everybody? Okay. For me, 2022 was a year of questions. Going back to just asking a lot of questions. And with that, I invite you all to step into the space of welcoming the new year with joy and expectation, to conceive of yourself as being like a pregnant mom awaiting the birth of the new year. And you have no idea of what that child is going to look like. All you know is that you are filled with love and joy and expectation. And I thank all of you for being with us throughout this journey, for being with us throughout 2022. And I'm excited to be with you again in 2023. And with that, I bid you adieu and sayonara and inshallah and with love.